Good morning and good evening from wherever you are dialing in. My name is Steve Hamill. I'm the Global Lead for Policy, Advocacy, and Communication at Vital Strategies. And on behalf of Economics for Health at Johns Hopkins University, Vital Strategies, and the American Cancer Society, welcome to today's webinar on the launch of our newest tool, the Cost, Recovery, and Revenue Estimator, or CoRRE. CoRRE is a new interactive modeling tool that demonstrates how countries can use tobacco taxes to reduce smoking, increase economic productivity, and recover millions in healthcare expenses on treatment of smoking-related illnesses. It's an important moment to put this data at the fingertips of governments. We've all seen major pullbacks in health and development aid globally, and many countries are facing severe cuts to their health programs and looking for revenue to sustain critical health services. And health taxes should be an urgent consideration to almost every country in the world. In fact, the Task Force on Fiscal Policy for Health has shown that increasing the price of tobacco, alcohol, and sugary beverages by just 50% could save 50 million lives over 50 years, and such taxes would potentially generate $3.7 trillion globally in just 5 years. So CoRRE is a natural part of the Tobacco Atlas, which is a leading global resource for journalists, policymakers, and advocates who want to understand the latest data on the global tobacco epidemic, progress that has been made on tobacco control, and the latest products and tactics being deployed by the tobacco industry. The Atlas includes issue-by-issue data and analysis of top issues in tobacco control and a detailed country fact sheet for every country in the world. You can visit Tobacco Atlas to learn more. Today, we're going to show you a brief overview of the current state of tobacco control and background on the tool and a demonstration, and we have time for a short Q&A. For the Q&A, please use the Q&A button at the bottom of your screen, and we'll be happy to answer as many as we can in the next 30 minutes. If you are a journalist, please identify which outlet you are following up from. And thank you for joining us. And with that, I'll turn it over to Dr. Jeff Drope, lead author of the Tobacco Atlas and research professor of public health at the Bloomberg School of Public Health at Johns Hopkins University, where he leads the Economics for Health program. Jeff, over to you.
Thanks so much, Steve. And thank you, everybody, for joining us today to witness the launch of the new Cost Recovery and Revenue Estimator. We're really excited about this new tool and hope that you will be as well. This is a collaboration among Vital Strategies, the American Cancer Society, and the Economics for Health team here at Johns Hopkins Bloomberg School of Public Health. And I just want to give a really quick shout out to all the people who were involved. Unfortunately, too numerous to name here, but there have been many people involved in this, really committed to bringing this to fruition and the online tool. So we hope that you'll use it and you will spread the word about this tool to your friends and colleagues. Next slide, please. I'm just going to situate us as to why we're here. And I know on this, just looking down the guest list here, I think I'm preaching a lot to the converted, but nevertheless, it's always a great idea to remind ourselves how important this truly is. First, the obvious. Approximately 1 billion people smoke across the world. Another few hundred million use other types of tobacco products. Around 8 million people die from tobacco use each year, and about 1 million of those are what I would call innocent bystanders, people who are victims of secondhand smoke. So did nothing but be in the wrong place at the wrong time. We know that roughly half, possibly more, of all smokers are going to die from a tobacco attributable disease prematurely. And we also know that smokers on average live 11 fewer years than their non-smoking counterparts. So that means a whole lot of sickness and a whole lot of young people that are dying from smoking attributable disease. Next. Now for the less obvious and probably the reason, largest reason we're here today, and that is the economic harms of tobacco use. We know from estimates that smoking alone causes about $2 trillion in economic costs each year globally. This is about the equivalent of 2% of global gross domestic product. And this is a zero-sum game, as it were. Essentially, the money that we are spending on smoking, either directly or through all of the costs of smoking, is money that we're not spending on other things that are good for us, like health and education. So this is really, truly problematic. But what we've learned is it's not just the health costs from smoking-related sickness. In fact, that's actually less, much less often than half of the total costs. It's really the huge negative effects on productivity. What we've learned is that smokers are generally much less healthy and economically productive than their non-smoking peers. Smokers miss work because they're more likely to be sick. They're less productive when they go to work, and then smokers are more likely to die during their working years than their non-smoking peers. Next slide. So who bears the cost? Truly, in most countries, we find that it's those with lower income bearing the greatest cost. They spend a larger percentage of their income on tobacco compared to higher income households. And just to give you some flavor of this, for example, in the Western Balkans, households are spending between 10 and 15% of their total household budget on cigarettes. This doesn't even account for tobacco attributable disease and the costs that come with that for smokers. So we know that tobacco use is a major barrier to economic development for all countries, but particularly lower and middle income ones. Next slide. This is just a really quick figure to show us what's going on in terms of tobacco use causing poverty and then making it worse. What we know is that those in lower income groups are frequently more likely to smoke because they're being marketed to very, very aggressively by the tobacco industry. So then because they're more likely to smoke, they're spending more of their money, as I just said. They're more likely to fall sick, so they lose that income, and then they are actually more likely to die a premature death, and then they lose that income. Foregone income number 3 there, and then you see the households following even further into poverty, and then, of course, becoming more likely to smoke because of what I just said about the aggressive industry tactics. So this is truly problematic and a huge barrier, as I said, to economic development and overall social development. Next slide, please. Taxing tobacco products is absolutely the best strategy we know to address high smoking prevalence. We know that people are sensitive to changes in cigarette prices, and the best way to get those changes is to raise excise taxes. Smokers who react to these prices smoke less, or even better, they quit. And non-smokers, especially kids and youth, don't start because they're put off by the higher prices. We know that around a 10% increase in price is going to lead to about a 5 to 7% decrease in consumption. The larger the tax increase, the larger the effect. So you can see that this can have an enormous effect on both initiation and cessation. Next slide, please. So we've tried to bring this all together in our cost recovery and revenue estimator, CoRRE, as we call it. We know that reductions in smoking prevalence are going to generate millions or more in new tax revenues. We know that it's going to substantially increase economic productivity, and we know that we can recover millions in tobacco-related healthcare expenses. You're going to see all of this in one moment in our estimator tool, and I'm going to leave it there and hand it over to my esteemed colleague, Dr. Nigar Nargis, for an explanation of the tool.
Hello and welcome, everyone. Thank you, Jeff, for the nice introduction to the tool. I'm Nigar Nargis, Senior Scientific Director at the American Cancer Society, where I lead tobacco control research team. It's a pleasure to share the results of this exciting collaboration to develop the model to estimate the national economic impact of reducing smoking through increased tobacco taxation. And we have estimated it for more than 100 countries. Let me start with the simple golf analogy that you can see on the screen. Golfers think about 2 things. Can you go to the previous? Okay, thank you. So golfers think about 2 things. One is that how far the ball is from the hole, and the other is how much closer they can get with the next shot. We use the same idea to measure the economic impact of smoking. First, we measure the cost, that is how far we are from a smoke-free economy. which identifies the magnitude of the problem. And second, we estimate the recovery. That is how much we can gain by reducing smoking through policies like tobacco taxes, which points to the solution. Next slide, please. The tool is based on the basic idea that healthier people mean a stronger economy, and that smoking harms health, which lowers productivity and income. Can you click? So in this graph, the orange line shows actual or observed income falling as smoking increases. Next, click. The blue line shows potential income in a smoke-free world. Click again. The gap between them, the missed income, is the economic cost of smoking. Next slide, please. To measure the distance between potential and observed income, we use per capita GDP as the most commonly used measure of income. Next click. Think of this ratio of potential to actual income as the income we lose because we don't live in a smoke-free world. This idea comes from a big picture macroeconomic model that looks at what drives a country's productivity and income. Click again. Several key factors shape this, such as human capital, which is reflected in how many people are working, how likely they are to be employed, and how skilled and healthy they are. Smoking affects this directly by harming health. Physical capital and research and development are the other two major factors that interact with human capital. All these pieces work together to boost productivity and income. But when smoking reduces health and human potential, it slows everything down. And that's what the ratio of potential to observed income helps us to measure. Next slide, please. First, we look at the relationship between smoking rates and income using data from US states. We use a key number called elasticity, which tells us how much income changes when smoking rates change. Click, please. This elasticity is fed into a formula derived analytically from the model to estimate the ratio of potential to observed income. In the interest of time, I encourage you to look at the CoRRE tool documentation for the technical details. With this estimated ratio of potential to observed income, we estimate what the per person income could have been. That is the potential income if smoking rates were lower. Click again. The difference between potential and actual income is what we call missed income. This is the income lost due to smoking. Click. Over time, these losses add up. We calculate the cumulative income loss by adding up missed income year after year. This shows how smoking not only affects income today, but also slows down future growth. Click again. When we scale this up to the entire population, we get the national economic cost of smoking, which is a powerful measure of how smoking impacts the economy. Next slide, please. In the second part of the model, we estimate the potential income we could reach if a policy like a tobacco tax successfully lowers smoking rates to a target level. Click, please. We compare this to what income would look like if we didn't make any changes. That is the status quo. Click, please. The difference between these two, that is the income with the policy versus without it, shows us the economic gain from reducing smoking. Click again. We focus on a 5-year timeline, which is a realistic period to start seeing health improvements like fewer deaths from reduced smoking. This gives us a clear picture of how much economic benefit we can expect from effective tobacco control policies and how quickly we can start to see the results. Next slide, please. We also estimate the tax revenue gain from higher tobacco tax and prices to reduce the smoking. Click, please. So we first calculate the price needed to reduce the target level of smoking reduction, and then estimate the tax increase needed to raise the price. Click, please. And then project tobacco sales at the new price. Click, please. Then estimate the new tax revenue. Click. And then finally, compare to the current revenue to find the revenue gain. Click, please. Next slide. We also estimate the health costs of smoking, as Jeff has already pointed out. The direct costs, that are the extra healthcare spending to treat smoking-related diseases, and the indirect costs, that is the lost productivity from illness and early death. Previous studies have provided global and country-level estimates of economic costs of smoking based on this approach. Next slide, please. The national economic cost estimated by the CoRRE tool gives us a comprehensive picture of the national level economic burden of smoking accumulated over years. Though the parameters were based on US data, the model's core relationships apply globally. That makes CoRRE a valuable tool for countries worldwide to guide tobacco control policies. Next slide, please. I hope this gives you a glimpse of the work behind the CoRRE and how it can help build healthier and more prosperous societies. Thank you all.
Thank you so much. Our colleague Salman Tu'u from the Economics from Health has kindly offered to demonstrate the tool. Rather than deal with potential lag through a live demonstration, we have a video prepared that I'm going to share now from Salman. But I am noting that at tobaccoatlas.org, the CoRRE tool is live now, and you can use it yourself. So I'm going to share that video now on how to use CoRRE.
Hello, in this video, I will walk you through how to navigate the CoRRE Estimator. This is the landing page of the Estimator. Right at the top section, user will see a brief guide called How to Use the Estimator. It provides brief instructions on getting results. At the bottom of the page, there is a list of FAQ to get familiar with the tool and a citation for reference. To use the tool, users need to select 3 key parameters to generate estimates for the desired country. These parameters are the country of interest, desired percentage point reduction in smoking prevalence, and the desired currency. First, select a country from the drop-down list. The drop-down list includes a full list of countries and territories, but not all of them will generate estimates. For some countries, the result may appear as NA, not available, because missing or incomplete data required for the calculations. They are included here as placeholder in case data from the local sources becomes available in the future. We are going to select a random country to view the entire estimator. By default, the estimator shows the estimate in US dollar for 1 percentage point reduction in smoking prevalence. Next, choose the desired reduction in smoking prevalence. User can reduce prevalence by up to 5 percentage points. Simply select the level of reduction by clicking the corresponding value in the boxes. The estimate shown below in green color will be updated automatically based on the selection. The third parameter is the currency. User can choose between US dollar, local currency, or purchasing power parity PPP. As an example, I will select Mexico. $2 percentage point reduction and US dollar. Essentially, we are looking at the estimates of Mexico resulting from 2 percentage points reduction, that is, from the baseline 13.4% to desired prevalence of 11.4%. Once these parameters are selected, the estimator will display 5 key outputs. First, it shows the smoking attributable national economic costs, which reflects the total economist loss from smoking cumulative over 15-year period. Then it presents the expected national economic cost recovery from smoking reduction. This is the economic gain that can be achieved within 5 years following the time of intervention. Next, it shows the baseline and recommended cigarettes price per pack. The recommended price is the price level required to reach the target smoking reduction. Next to this, we have the baseline and recommended total tax per pack of cigarettes. The recommended tax will support the increase in price. Finally, the estimator displays expected cigarettes tax revenue gain, which is the additional tax revenue generated from implementing the recommended cigarettes price and tax increases. The green color figures national economic cost recovery, recommended cigarettes price, recommended total tax per pack of cigarettes, and expected cigarettes tax revenue gain will be updated based on the level of desired smoking reduction. In order to help users interpret the result correctly, information icons are displayed next to each output. When the cursor hovers over an icon, a tooltip appears with the interpretations for the corresponding result. There are a few points to note. If a country doesn't have sufficient data for estimates, an A will appear. For example, let's look at Angola. You can see the estimates are shown as NA because Angola does not have sufficient data to compute the estimates. Again, if a country has a baseline smoking prevalence below 5%, which is already very low, the estimate will appear as 3 dashes. Take Uganda, for instance. Uganda baseline smoking prevalence is 3.4%, so estimates are not displayed. This is because in countries like this, economic gain from further reduction in smoking may be negligible. Similarly, if the prevalence is below 10%, only estimate for 1 percentage point reduction will be displayed. For example, Costa Rica. It has a baseline prevalence of 7.9%. In this case, the estimator will show estimates for 1 percentage point reduction only. When a reduction of 2 or more is selected, the estimates will not appear. This is because for countries with very low baseline smoking prevalence like Costa Rica, reductions greater than 1 percentage point in the short run may not be practicable. Below these results, user will find annotations explaining why some data are not available. As mentioned earlier, NA indicates insufficient data to calculate the estimates, and 3 dashes indicate the estimates are not shown because of very low baseline prevalence or a desired prevalence below 5%. At the bottom, there is a section on cost of illness attributable to smoking. The estimator shows the total cost of illness attributable to smoking. It is further broken down into direct costs, which reflect productivity losses due to mortality and morbidity, and direct cost, which refers to healthcare expenditures. They are presented as annual estimates. Beneath this, there are several action items for users. Users can download report based on the selected redaction level and currency. To download all the available report, simply click Download All Reports, and a zip folder containing all the report will be downloaded. Users also have the option to download the entire dataset. This may be particularly useful for users who want to conduct regional and multi-country analysis. The estimator includes a share function, allowing users to send a link via multiple applications. For those interested in the methodology, a technical guide is available to download here. It outlines all data sources, parameters, calculation methods, and other technical details. CoRRE Estimator is accessible at www.tobaccoatlas.org/CORRE. This is the end of the walkthrough. Thank you for watching.
Thank you, Salman, for that terrific walkthrough. We have time for a few questions. Sorry, we'll be going over a bit. I just wanted to sort of conclude this portion by saying that now is the time for action on health taxes. And I think, Economics for Health, Vital Strategies, and American Cancer Society hope that putting this information at the fingertips of advocates and journalists and policymakers really accelerates the adoption of health taxes, especially taxes on tobacco, which, as we've seen, have that triple benefit